for our community to utilize this hospital. In order for the city to continue to do the work that they do to support the hospital, we got to hear from you. We got to hear and know that this is what you want. This is what we need because this is ours. This is who we are. And you know, I've worked on Jefferson Street for 20 plus years. So you all know that things are not looking the same as they were when I first came. And many of you, Dr. Webb was at TSU when I came in. Don't act like you don't remember. His wife and I were sweet mates at TSU. We had good times over there at TSU. But I want you all to really understand what it is that I'm saying. It is going to take teamwork. It's going to take that same teamwork, the tenacity, the compassion, and all of that it has taken this Tennessee's Titans to get where they are. Because people didn't believe. But if we believe in Metro General Hospital, if we believe in Dr. Webb, if we believe in the care and the services, if we believe in the wonderful chaplain that they have to help pray over the patients that are there, if we believe in them, we've got to go out and let everybody know. Because I know I will. Will y'all help me do that? Yes. You got to do better than that. We ain't just saying y'all got to let me know. I'm not a pastor, but I'm going to act like it today. So y'all got to, I'm like I'm Bishop Lane. We got to maximize. We got to maximize it, okay? But I really do want you all to know that I am behind Metro General Hospital. I'm promoting that with the city. Every chance I get, I'm going to tell them. And I do ask you to join me because the quality of services are great. I was talking to my daughter yesterday, my oldest daughter, and she was like, and how much did I weigh, Mama? 9 pounds and 5 ounces. And you weren't even the biggest one. She was like, what? Had them all right there. And we are still supporting Metro General Hospital. And she'll turn 35 January the 29th. And I believe then, I believe now, and I will believe forever. This is something that I know, something that I have experienced. And I ask you to give it a chance yourselves, to let them show you the fine work. I don't know if y'all seen that food pharmacy over there. They're doing some innovative things, doing some wonder, and it's so clean over there. I almost get off the floor, it's so clean over there. I'm like, that is a wonderful, wonderful place to be. You just love being in the presence. So I encourage you to go there, get your mammograms, make sure, because they don't want to keep you there, they just want you to come in and find out and do a little check-in, a little drop-by. Make sure everything is all right. Can we do that?
Yeah.
All right.
Just believe it. Try it out. You might like it. Thank you.
So how about it for Council Lady Hurd? I hate following you. This is 5 years. This is a celebration. I want to recognize a few other people. Council Lady Berkeley Allen, we already recognized. Where is she? There she is. And we have members of our medical staff here. I want to recognize them. Dr. Faye Awanzi, who is our optometrist. Dr. Doug Altenberg, who is a urologist. Dr. Eric Neff, orthopedic surgeon. Dr. Andrew Pierre, our podiatrist. A board member, Dr. Fabian, is here. Reverend Joel Sims. Okay, I think I've covered all of that. Now, oh, Dr. Monica Davis. Thank you all for being here. And oh, Dr. Long. All right. Councilman Hall. Welcome. So, I wanted to say one thing before I turn the microphone over. You know, it's one thing to be underinsured. You will oftentimes feel the experience of adverse health outcomes when you're underinsured. But there's another way. When you're uninformed. You have to be informed, because if you're uninformed, you can experience the same adverse health effects as if you're underinsured. So tonight we're going to be sharing a lot of information. We want you to definitely pay close attention. We're going to cover 5 years of activities, 5 years of progress, 5 years of innovation. We're celebrating the blue, the light blue, the dark blue. I don't know if that was intentional, but it certainly goes in line with the efforts that has been put forth by our own Tennessee Titans. So we want to be the Metro General Titans tonight. And so without further ado, I want to bring Kathy Poole, our Director of Marketing, here so she can get started and engage in the program.
Thank you, Dr. Webb. If we can move forward to the next slide, please. Welcome, everyone. Again, my name is Kathy Poole. I'm Director of Marketing and Community Relations here at Nashville General Hospital. I want to remind everybody that when you walked in, you were given our 2019 annual report as well as an index card. So if you'd like to write any comments or ask any questions, please fill out the card, and we will be collecting those for our panel Q&A at the end of the presentation. Next slide. Nashville General Hospital originally stood on the highest bluff in downtown Nashville, overlooking the Cumberland River. Its existence was always to support and care for those who could not afford to care for themselves. It was the city's first full-fledged medical facility. We had the first trauma center. Always fighting for its existence, all while training Nashville's top doctors. Nashville General Hospital was the heartbeat of Nashville's healthcare delivery a century before Nashville became the healthcare capital of the United States. A year after opening, with 1 doctor and 7 nurses, the hospital established the first nursing school between New Orleans and the Ohio River, and it remained open until 1970. In 1962, with the creation of the Metro Charter and then the consolidation of the government to Metropolitan Nashville and Davidson County, the Department of Hospitals was established, with both Metropolitan Nashville General Hospital and Nashville Metropolitan General Hospital. In 1987, Nashville General Hospital was one of the founding members of the Our Kids Center, and Sue Fortwhite, who is the Executive Director, is here with us today. Thank you, Sue. The Our Kids Center's mission is to provide expert medical evaluations and crisis counseling in response to concerns of child sexual abuse. They are a center of excellence. They are nationally recognized, and we are so proud to be affiliated with the organization. Last year, they launched whatifitoldyu.com across the entire United States, so that no matter where you are, if you had been or or suspect somebody or need to know answers, that website will drive you to the services in your local community. On January 27, 1998, Nashville General Hospital relocated from 72 Hermitage Avenue to 1818 Albion Street. The following year, the Department of Hospitals became the Metropolitan Nashville Hospital Authority, and the city entered a management agreement with Vanderbilt University Medical Center that lasted until 2012. From 2004 through 2013, General Hospital was subject to 4 consulting companies and 1 Metro internal audit, all with the same question. What's the business model? How do you care for those who don't have the ability to care for themselves? Do you break even? Are you always in the red? How do we fund you? The dollars associated with each of these consulting groups would have been better spent being given back to General Hospital through capital or proper funding. By 2014, Nashville General Hospital had beds that were at the old location. They relocated with us. Semi-private rooms, which is not the standard of care in the community. Workstations on wheels and other medical equipment that was well beyond their reasonable life. In 2015, Dr. Webb was the first Nashville General Hospital CEO hired by the Metropolitan Nashville Hospital Authority Board. And he was the first CEO without interim or acting behind his title in 5 years. He wasted no time getting reacclimated to his college hometown, or at least one of them. Birmingham would be the other. Next slide. When Dr. Webb arrived, he found an organization in need of everything, from employee morale to systems and processes. He immediately set forth to stabilize hospital operations by replacing and adding key leadership positions to have a complete leadership team in place, something the hospital had not had since 2010. As a member of the executive team, I am proud to be part of one of the most diverse executive teams you will see in the city. Through Dr. Webb's leadership, we have worked hard over these last 5 years to be where we are today. Next slide. If you follow us on social media, you may have seen that Nashville General Hospital received an A grade from the Leapfrog Group. They're a national nonprofit organization driving quality and safety of American healthcare. 33% of hospitals across the nation received the A grade this fall, and we are proud and excited to be one of them. Nashville General Hospital is accredited with the same regulatory agencies as other healthcare facilities. We don't get a pass for being a city hospital. This includes the Gold Seal of Approval by the Joint Commission, the Top Hospital Regulatory Accreditation Organization, Silver Level Accreditation by the American College of Surgeons Commission on Cancer. We have maintained accreditation with the Commission on Cancer since 1941. We are the second oldest cancer registry in Nashville. We achieved the highest level, which is level 3, patient-centered medical home recognition by the National Commission for Quality Assurance. We are a recognized diabetes care management practice with them as well. And we achieved a level 2 commitment award by the Tennessee Center for Performance Excellence, which is this state's Malcolm Baldrige Quality Award. To understand how much was truly accomplished over these last 5 years under Dr. Webb's leadership, we have to go back to 2015. Next slide. When Dr. Webb took the reins in January, he set expectations that we had to change the hospital's business model. He laid out terms like chronic disease model, patient-centered medical home, Aldridge Performance Excellence, Population Health Management, and my favorite, AIDIT, which is the 5 fundamentals for patient communication. Customer service was important to him. So we acknowledge, we introduce, we talk about duration, we explain, and we say thank you when you come into Nashville General Hospital. In addition to all of this, we had 600 employees go through this training in a 3-month period, and Dr. Webb made sure to attend over 90% of those sessions so that he could meet the employees face to face. We also celebrated our 125th anniversary that year, and we had our first ever community health fair, because community is very important to Dr. Webb as well. Next slide. In September 2015, the board and executive team came together for a strategic planning session, the first one in over 7 years. During this session, a new mission and vision was established to improve the health and wellness of Nashville by providing equitable access to coordinated patient-centered care, supporting tomorrow's caregivers, and translating science into clinical practice. That is what we do each and every day. We moved forward with a level 1 application of Aldridge. We opened a full-fledged gift shop. I know that sounds crazy. Every hospital should have a gift shop. We did not, but we do now. We introduced valet parking to our patients and visitors. We opened a retail pharmacy so that employees and our patients have access to medication before they leave the campus. We were also the first Middle Tennessee location for Mother's Milk Bank, and we hired our first full-time executive director of our foundation. Next slide. The following year, in June 2016, we partnered with Metro Human Resources and the Mayor's Office and provided biometric screenings to over 700 Metro employees throughout the city. The timing could not have been more perfect. We had just done a major renovation to our women's health floor, and we were getting ready to open the Nashville Healthcare Center right on our campus. The NGH Foundation had its inaugural art show and open house, and also established their annual fundraiser, a jazz brunch. We also launched in April our first ever Metro public relations campaign, where patient-centered care comes first. We appreciate everyone who lent their faces, their comments, their names to this campaign, because what we try to do is drive Metro employees to utilize their own Metro healthcare facility. Next slide. With the good, we did have a difficult year in 2018, or fiscal year 18. Our success with the campaign was relatively short-lived. We did increase Metro utilization, but then there was an announcement to close inpatient services at Nashville General Hospital. From the bar graph on the slide, you can see as soon as that announcement was made, which is with the red star, we saw a drastic decrease in the number of Metro employees utilizing our facility. We read all the headlines, we actually lived them, and many of you in the room, especially the pastors, were instrumental in helping us navigate the storm. And I would also include our councilmen. Thank you very much. We launched NGH Here to Stay on our 128th anniversary that year, so that we could get right back to business for the health of our patients and our community. There was a lot going on the 11th floor, but Dr. Webb made sure all the patient care areas stayed the course, and that's exactly what we did. Next slide. In 2019, we had the ribbon cutting for our food pharmacy. We took the Here to Stay one step further for Here for Good, And we opened an off-site location along Charlotte Avenue so that Metro employees and our patients would have better access to our providers. Next slide. And then this year, fiscal year 2020, we're only halfway through the fiscal year, and yet it feels like we've done so much. We hired our first-time full-time chaplain. We had a ribbon cutting for our chapel on site. The foundation, partnering with Second Harvest Food Bank, received one of 6 hospital and food bank collaboration grants across the country. This grant allowed us to provide fresh food to those of our patients who are members of the food pharmacy or participate with the food pharmacy, as well as staff it with a nutritionist 5 days a week. We are also looking at continuing to expand our services on Charlotte Avenue with urology, orthopedics, and surgery. Another thing like the gift shop, we now offer room service to all of our inpatients. That's a very big deal.
Good evening, everyone. I'm going to talk to you tonight just a little bit about 5 years ago when Dr. Webb came on the scene. This gentleman is a visionary person. He has amazing visions of what he wants to see in our healthcare community within the Nashville General Hospital. He came on the scene and he started talking about integrated delivery models and the patient-centered medical home and the chronic care model. And these were concepts that were not known in the Nashville area at that time, and especially at Nashville General. He had done this in other places, and when he came here, he said, this is what we need to be doing. And as Kathy said, he started putting a plan into place to get us to where we are today. He brought on the executive team that he has. We brought on our physicians that we have, amazing physicians with amazing educations that came to Nashville to help us with the patients that we see at Nashville General Hospital. He introduced us to the evidence-based framework, and this creates an integrated healthcare system. And what that means is that we do everything for that patient. The patient is at the center of our care. We want to be that continuity care for that patient so that we know what's going on with that patient. What happens when a patient goes to multiple different ERs and multiple different doctors? No one knows really what is going on with that patient. By doing that integrated care model that we do with the chronic care model, we look at that whole patient. We want to be their provider of choice, and we want to be the one that, if they're going to primary care, if they need to go to urology, they all do it here so that we're on one electronic medical record, so that no matter who they're going to, they know exactly what's happening with that patient. The whole goal of the chronic care model is to provide quality health care, and the second, one of the second phases to that is to keep our costs down. When we start talking about the AAA, one of the legs of that model is to keep our healthcare costs down, and Nashville General has been able to do that. Next slide. So the goal of the chronic care model is to improve care and improve our outcomes, and we've been able to do that. As I said, one of the things that we want to do is to lower our per capita costs per patient. We want to improve our patient satisfaction. Right now in the clinics, we're at 90%. So that means that 90% of our patients that come to us will recommend us to other people in the community. That's not done very often in hospitals and in clinical settings, so that's a good thing for us. We also manage our patients. It's called population health, and what we want to do is make sure that we manage that whole patient so that we know what's going on with them. We recall them or have them come back when they need to be seen for one of their chronic conditions. The chronic care model is really all about our chronic conditions. The majority of patients in the United States today have at least one chronic condition, and most of them have more than that. So we want to make sure that we're managing all aspects of their care. The other thing we want to do is to improve our outcomes, and I'm going to talk about that in just a second, but If you're really doing the patient-centered medical home model, you'll be able to improve the outcomes of your patient. By improving outcomes, I'm talking about their disease will be under control. We want them to be seen in the clinic rather than in the ER. We want to do proactive care rather than reactive care. And what that means is that we want to touch our patients before they become ill and have to go into the hospital. Next slide. So the slide I have here is really just about the framework that we utilize. There are 3 models that we use. And what it all boils down to is that we want to provide coordinated care. Our providers all work together to make sure that anything that needs to be done for that patient, we do within our organization. As I said, we want to be proactive rather than reactive. And we want to make sure that our patients get annual visits rather than sporadic visits so that we can find out things about our patients prior to them becoming very ill. The other thing is we have an electronic medical record so that no matter where that patient is within our system, the physician can bring up that patient and know exactly what's going on with them to provide that coordinated care that we talked about. Next slide. So what we do with our patients is we stratify our patients by risk. And what we do is we look at everything going on with that patient, and depending on if they have a chronic condition or how many chronic conditions they have, if they have depression, if they have many medications on their list, we look at all of that and we stratify those patients. And the patients that are considered high risk, we get them into our care management team. By having a care management team, that helps us manage that patient and help keep them healthy. Next slide. So our care management team consists of many, many people, and we're very blessed at Nashville General Hospital under Dr. Webb's leadership. We've been able to coordinate a care management team that can handle most of the things that happen in our patients' lives. Whether you're insured, uninsured, it doesn't matter. We don't look at that. We want to make sure that our care is equal across the board. We help our patients with transportation. We help our patients with housing. We help them with medication assistance. When they walk out that door, we want to make sure that they've been able to get their medications so that when they go home, they have them. Many patients, when they leave the doctor's office, they go, well, I have a choice. Can I pay rent this month or do I get medications? We want to make sure that that's not a deterrent for our patients. We also triage our patients when they call in to make sure that if they need an appointment right now today, we get them in that day. We don't want them to go to the ER. We want them to come into the clinic. The other thing is we manage our referrals so that if a patient needs to see a specialist, we have those specialists available for them, or we have agreements with other specialists within the community. So whatever care they need to be done, we're able to do that. The other thing that we've added to our care management team is behavioral changes. They say that it's proven that if 95% of our patients are 95% more apt to be healthy and manage their chronic diseases if we educate them. That's part of what our care management team does. They do classes for our patients for the different disease processes, and they also help them change their behavior. We all know what it's like if we have something going on and we're trying to change that behavior. It's very hard, and a lot of people don't know how to do that change. So our care management team helps them and motivates them to change their behaviors. We have education classes that our care management team does on the majority of our chronic care diseases so that they understand what their disease is and how to manage that, and we help them do that. Next slide, please. So we talk about our patient outcomes. We've been very successful over the last year or so that we've seen a lot of improvements in our chronic diseases in our patient. Right now, 71% of our diabetic patients are in control, or in other words, their blood sugars are at a level that they can remain healthy. 69% of our patients with hypertension are in control. Their blood pressure is at a level that they'll remain healthy, that we aren't going to see the other disease processes coming on because their hypertension is out of control. As I said, 90% of our patients are recommending us. And I'm going to introduce two additional people who are going to come up and talk. Tanisha Harris, she is our Director of CHIN, and Chaplain Lee, he is the in charge of our pastoral services at Nashville General Hospital.
Good evening. Next slide, please. Next slide. The Congregational Health and Education Network, CHEN, is a faith-based initiative using education as the primary driver to address health disparities, those preventable differences in diseases. CHEN addresses these disparities by impacting the social determinants of health. The social determinants of health are the conditions in which we are born, live, grow, work, and age. Things like employment, income, transportation, housing, education, access to healthy food options, and even quality health care. Education is the primary social determinant of health that significantly impacts health disparities. And CHEN works to bridge health and education to create resources in our communities. Currently in CHEN, I'm excited, we have 44 congregations in our network, and our member benefits are categorized into 4 components. We focus on educational programming, health education, healthcare access, and membership programming as well.
Next slide. Good afternoon, good evening. I'm Chaplain Lee, and I want to, for a moment, just to acknowledge all of my pastors that are here. If I could have you to stand, wave your hands. I see Reverend Fuzz that's here with us this evening. I see Reverend J.J. Green. Yes, all right. Reverend Bishop Mitchell, Pastor Sales, and we have Pastor Derek Faison that's here with us. Pastor Anthony Sinkfield was with us, but he had to get to a NOAA meeting. As we know, our pastors are often under a lot of pressure, a lot of things they have to do. So it's important that we make sure that we're taking care of them just as well. So one of the great components of CHEN is that we have teaching sessions. And in those teaching sessions, we talk about things that help them with their personal life and for their lives in their churches. And we want to make sure that we're giving them what they need. Some of the things that we are discussing is what's coming up, as you see on the slide here. We're having a teach-in for them on mental health and compassion fatigue, what that looks like and how to identify where right now in the turmoil at our very own hospital, what it looks like to deal with them through suicide. How we deal with mental illness is very important. So these are the things that we're concerned with, that we want to make sure that we bring forward to our CHEN members. One of the social determinants that we look at is that religion. It is definitely a social determinant by what we're teaching from our pulpits in our congregations. So we're serious about the work and engaging our pastors, engaging our imams, engaging our rabbis, engaging all of our faith-based leaders and their congregations, having them very much a part. We need you to know that CHEN, as Dr. Webb would let you know, that Nashville General and CHEN is a ministry. And that ministry is being part of taking care of the health of this community. So with that, we take care of the health for spiritually and integrating it with education to help out with health care for our members and our constituents. We know that by making sure that we have healthy congregations, having them made whole, that makes good health for the Nashville community. And to speak more on good health and great opportunities, we'd like to bring now Mike Ventures to the stage, who is our Director of Food and Nutrition Services. Mike Ventures.
As you just heard, my name is Michael Ventures, Director of Food and Nutrition Services. I am a registered dietitian and have a master's in clinical nutrition. And under the truly excellent leadership of Dr. Webb and his executive team, following his initiative at Food is Medicine, we have created a food pharmacy to help combat food insecurity among our patient population, as well as educate them on the proper food choices for disease state management and prevention. Now, this food pharmacy is truly innovative. This is the only one in Tennessee. This is probably about 3 in the whole United States as at this level, if that. It is truly innovative. Next slide, please. All patients at Nashville General and NAC, which it consists of the ER, outpatient, inpatient services, cancer center, are all screened for food insecurity. Every patient answers some questionnaires, and if they screen positive for the food insecurity, then they are given a food prescription. And when they get this prescription, they are sent to the food pharmacy. It's at no cost to the patient. The program is actually a 3-month program, and there's no cost to the hospital. It's through the foundation with grants, as was mentioned earlier. The patient gets shelf-stable products and fresh produce. They have education on improved food choices for chronic personal diagnoses. Next slide, please. We'll talk a little bit about trade-offs. If you're a food insecure patient, you have to make hard decisions. Food versus medical expenses, or paying for prescriptions, paying your utilities or housing, transportation. Can you imagine being in a situation where you had to choose between your medication or eating? That's a very difficult situation, and it causes very high stress levels, which even exacerbates their disease state. Next slide, please. A lot of people ask, what is the difference between a regular food pantry or food bank and a food pharmacy? Well, the difference is, the major difference is a food pantry usually just focuses on hunger. And we are focusing on knowledge, nutrition knowledge, and education along with that hunger. The difference that you're seeing is that a regular food pantry would not have fresh fruits and vegetables available all the time. They may have it seasonally, or if someone donates that product, but it's not there all the time and readily available. They don't explain food preparation or food labeling, which I find is very important. Food labels give you a lot of information, and what I've been finding, along with all the patients that we have been seeing, is that most people just do not read food labels. They pick an item they think that they'll like, and they put it in their basket with no idea what's actually in that product. So what we do, for example, we teach them, based upon their disease state, for example, hypertension, which is high blood pressure, to read the food labels and identify sodium. Sodium is one of the products or nutrients that could cause high blood pressure. So we teach them where to look for that on the food label and how to identify that in their product. And on the flip side of that, we also teach them to look for things that are healthy for them. For example, fiber. You want to, what I've been finding on the hundreds of patients that have come through the food pharmacy is the 2 main things that I've seen that they are not consuming enough of is water and fiber. And fiber is very important, and that's one of the main things I focus on. If you look here on the slide here, a lot of the conditions that we have at the hospital are nutrition related. You have high blood pressure, coronary artery disease, diabetes, morbid obesity, cancer. We don't just focus on removing items or giving them healthy options. We also focus on cancer patients that need high calorie, high protein foods to maintain their treatments. And if they end up losing weight, then they are not able to stay within treatment. So we try to help them through their treatment as well for obvious reasons. Next slide, please. No, I'm sorry. The last one is a video. And the video is of Diane and John from News Channel 5, and they're actually here tonight. They're one of our success stories. They've been in the program for months, along with hundreds of other people that have benefited from the program. So please roll the video.
No one should ever go to sleep hungry, especially when they're already dealing with a medical condition. In Davidson County, nearly 100,000 residents are living with food insecurity.
A new grant given to Nashville General Hospital is working to address those needs. News Channel 5's Cena Sleen explains.
I mean, I'm surprised because I've always loved sweets.
Diane Carricker checks things off her grocery list with ease.
Peanut butter, this is my protein at night, 2 hours before I go to bed.
But a year ago, things weren't so easy and money was tight.
I'm retired, so I'm just living on one paycheck once a month.
Diane discovered she had type 2 diabetes in February.
I never thought to look at what I was putting into my body. So now I have to look at that because of my diabetes.
She has been working with the food pharmacy at Nashville General Hospital to maintain a healthy weight. The food is free for patients.
You look at the price, especially for fruits and vegetables, and it's really hard to do that. Plus, I have to pay for my medicine. I don't have health coverage, so the hospital helps me out with that too. Paying for prescriptions and trying to eat right. This program is really beneficial to people like me.
Having assistance like the food pharmacy is really important in Middle Tennessee. In Davidson County, there are nearly 100,000 residents dealing with food insecurity.
I've learned to not use as much sugar, so we know that they're different in their content.
And each person deals with their own struggles.
What is it about oatmeal? It sticks to my intestines.
John Turner.
I would prefer oatmeal because of the fact that I'm trying to always maintain weight.
Needed to gain weight.
It's very hard because you're unable to afford to purchase the nutrients that you might need, just because you have other responsibilities.
He worked with the food pharmacy to learn what foods would help him.
You have to change eating habits.
Achieve that goal.
I go to the ingredients.
The $100,000 grant from the AmeriGroup Foundation will help keep the food pharmacy going strong and allow it to grow.
These kind of partnerships change lives.
Cena Sleen, News Channel 5.
Great idea. The food pharmacy is a partnership between Nashville General Hospital and Second Harvest Food Bank of Middle Tennessee.
No one should ever.
Right now, we'd like to bring up our Ask the Experts panel. We have Dr. Webb, Mark Brown, our Chief Operating Officer, Bruce Nairmore, our Chief Financial Officer, Dorothy Bennett, Chief Ambulatory Services, Veronica Elders, and Dr. Bullock, our Chief Medical Officer. So earlier this evening, everybody filled out some cards with some questions. And here we go. What will happen to the hospital funding with the mayor's new budget? Dr. Webb or Bruce?
The hospital will be funded. Let me just share one thing additional to that. The subsidy that we receive from the Metro is only a portion of what it takes to operate the hospital. We also have collections from our paying patients. Majority of our patients are paying patients. They do have the means to pay. About 45, somewhere between 45 to 50% of our patients usually cannot afford to pay. So what we do is we project on what we collect. We receive a supplemental fund from the state because we are a safety net hospital, so that's pretty consistently around $16 to $18 million. And what we collect and what we receive in that supplemental fund, so then what's left over to fund the total budget is what goes to the city as its subsidy. And one way of looking at that is the city's commitment to, in its own charter, to care for those that cannot afford health care is a commitment that was made years ago. And so what we do is we allow them then to have a reduced amount of what that's going to cost by helping with paying as well as supplemental dollars, because we are again, a safety net hospital. So think of it as the city being the guarantor or the insurance for the individuals in the city who cannot afford to pay for their health care. It's a nice partnership, and we, by virtue of the hospital being in existence, that $16 to $18 million that comes from the state is money that flows to us. If the hospital goes away, that money also goes away because you no longer have a safety net hospital. So that's just kind of give you an idea of the overall picture of how the hospital is funded.
Thank you, Dr. Webb. And I would also like to recognize Register of Deeds, Karen Johnson, as well as Vice Mayor Jim Shulman. Thank you for being here. Our next question. I heard last year that there might be a clinic around here. Is that happening?
That is something that we're taking a look at. We're having some discussions about that with our board. It's not a final decision, but we do view this area as an area that would benefit greatly by having a multi-specialty / primary care clinic. It would also be a nice outreach for us to get into other parts of the city and service the population of patients that we cater to. So it is something that we're looking at.
Okay. Another question, does NGH offer free screenings for the community? If so, what services are being offered?
Questions. I'm going to let someone else answer that one.
I can answer this one. We do offer free screenings through two phases, through the CHIN program, through our faith base, and also through Kathy, we do healthcare screenings at the Metro events, and I'm sure we would be open to doing healthcare screenings at other places. So if there's somewhere specifically that you're thinking about, just let us know and we can talk to you.
Okay. Why don't you become a trauma center?
I'm glad you asked that.
Dr. Bullock?
No, I'm going to let Dr. Bullock answer that one.
There you go.
Good evening. Thanks for having us. We currently are not a designated trauma center. If any of you had the privilege of coming and visiting our ER, you'll realize that all of our physicians are emergency medicine boarded and trained. Getting a trauma designation is a process. As you know, we have a level 1 here in Nashville, that's Vanderbilt. There are different tiers of trauma systems, and it is in our plan to apply for a trauma designation, a level 3 trauma designation in the very near future. There are multiple pieces that go into that. There's a lot of work that goes on behind the scenes, having some pieces in place, and also some partnerships that have to be developed for the patients that may at times present as one level and have to need services of a higher level. That is in our plan. We are working actively towards a level 3 designation this year. So not that we're not doing it, we do still see trauma that still comes in the door. We just aren't physically designated as that currently.
Thank you, Dr. Bullock. It's a comment and a question. I'm slightly disappointed there are no nurses present this evening, especially a CNO. 2020 is the year of the nurse. How do you continue to engage and retain your nurses? And I would like to introduce Veronica Elders, our Chief Nursing Officer.
Good evening, I'm Veronica Elders, I'm the interim chief nursing officer. We currently have a job fair, so if you know some really good nurses, from 11 to 7 on the hospital property. And so Ernie Allen has been providing some, or will be providing some commercials for us. So please do invite any nurse that you know to come and apply.
And also, we
and
have
nursing is in the house.
in the community in the audience today.
Yeah, nurses. Stand up, nurses.
Tell me if I can get financial assistance to become a certified nursing assistant.
Yes, we actually have a School of Health Sciences, and we have several programs, the EKG program, the CNA program, and the Radiology Technology program at our School of Health Sciences. And each of those courses, there's a mechanism in place that would actually pay for the CNA and the EKG course.
Thank you, Mr. Brown. What are you doing to help with the city's budget crisis?
I'll take this one first, although Dr. Webb is pretty good with his numbers. Right? We try to stay within sort of our swim lane in that $40 to $45 million range for subsidy, but it really is based on the level of services that we're going to offer. We don't want to shrink our services down to meet a lower subsidy level for the hospital. When you get that, we've got a group of paying patients, but we've got a large group of non-paying patients. And the city still, in the charter, has an obligation to provide care to those patients. So, Dr. Webb told you our appropriation this year was $43 million. The hospital budget is about $105 million. So the other $62 million comes from the state and our own self-generated sources. So we like to make sure that people out there hear that if this hospital went away or there wasn't a public hospital here, that $62.3 million that we generate ourselves would go. And the city would still have the same obligation to take care of those folks, whether they did it by paying St. Thomas or Vanderbilt to take care of those same patients. So the obligation is still there. We work very carefully. We have calls with Metro government every week with their finance department. They see our cash flow. They have access to our bank accounts. They know exactly what we have. They know exactly how much we're collecting weekly and what our weekly spend is going to be for payroll, supplies, and services. So we're extremely careful. I think I consider myself a steward, and I hold all these people with me up here accountable for the same thing, to be very careful with the Metro fisc, because we take that responsibility very seriously. So we try to stay in that $40 to $45 million range, but it's very hard to to project a year out what the presentations that come to the hospital, whether something's going to change in the marketplace. So we take it seriously, and we do our best to project. And the last couple of years, the budget has been very much right on the numbers. So hopefully we'll have another good budget for the 2021 fiscal year coming up shortly.
Are there plans to expand into the following areas? Mental health, inpatient and outpatient, behavioral pediatrics. There's a great need for both, especially in our vulnerable areas. Metro serves.
Certainly not pediatrics. We already have behavioral health as part of our integrated services. So we're going to penetrate that market by bringing on additional providers so that as we grow, we continue to have capacity for caring for the patients that come to us. But we don't have any plans right now going into the pediatric environment. one thing else on the cost that Bruce was just mentioning, if that was outsourced to other facilities, if Nashville General went away, one thing you need to know is that Nashville General's costs are anywhere from 15, or other providers' costs in this community are anywhere from 15 to 50% higher than Nashville General's costs. So you're not getting the same quality for the same money if that happens. So that's a consideration as that conversation comes up.
Can we see a show of hands of community members in attendance? That was one of the questions, so thank you very much. Another question was what method or methods are used to communicate these town hall meetings? I can go ahead and answer that one. We ran on 3 radio stations. We also placed ads in the Tribune and the Pride, and then also used outreach through our Pastoral Care Services Division, our congregation.
We're currently looking in several locations. Ms. Bennett and I have been exploring and looking at the demographics of each of the communities. And so currently we are pretty much all over town looking in different areas, because if you look at our patient population and the people that we serve all over Davidson County. Currently we're actually interested in the north sector of Nashville by nature, because that's where we're at currently. And so we're exploring all neighborhoods and placing clinics in different places where we feel like we'll be able to serve the patient population that we've currently been serving.
And then the next question was, is there a next meeting scheduled? If so, when and where? We just have been doing this one community town hall. We do have an open house, an employee art show at the hospital on March 10th, and that information will be going out as well. Why can't the other big hospitals absorb the charity patients and save the city money?
Want me to go first? I'll take a first shot. I think Dr. Webb did mention to you guys just before this that, you know, the cost, our cost at Nashville General for a 1.0 weight Medicare patient is significantly lower than the other hospitals in the market. It's not to disrespect Vanderbilt or St. Thomas or any of the other TriStar, but we are, our DRG rate is significantly lower than those other 3 systems. Therefore, most commercial payers and others pay a higher rate to those other facilities as well. So we had to have a lower cost equation to keep this hospital solvent. And so we operate thinly and with relatively low margins. And that's a benefit to those that purchase services from us. It's also a benefit to the uninsured patients, because we still can provide for them at a cheaper rate than the other 3 or the other 4 if the city was to have to pay those what market rates would be. And the truth is, if I were Vanderbilt, I wouldn't take a discount when my hospital is full. And that's just, I was a payer for 7 years working in this market and all around Tennessee. And it's difficult because some of the big hospitals are very busy. And so you can't blame them from a business standpoint if they do not wish to take a discount to care for uninsured or low-paying or TennCare patients. We welcome insured and uninsured patients with open arms. I've been doing hospital CFO work for 30-some-odd years, and I'll tell you, it's the one place where a patient with or without insurance can come in without fear of being embarrassed or treated differently because they don't have coverage. You can come in proudly and present yourself and explain your situation. Now that's first in 62 years, so happy to see it.
how does Metro plan on maintaining a footprint in Nashville with all the increased growth, gentrification in North Nashville, even with, I believe it says, the death of a county hospital? With the...
Even with what? What was?
Even with the... Debt.
Even with the debt?
Yes. Actually, that's my question. I'm a registered nurse, 14 years in, and my question was, with all the growth here in the city of Nashville, how do you all maintain your footprint here in Nashville with all the urban renewal, gentrification, whatever you call it? Also, the death of the county hospital is real. We're seeing it in the state of Tennessee, especially our rural areas. So how is Metro still going to keep a salient medical footprint here in Davidson County?
How does Nashville General? Okay. All right. So our model, you heard from our model tonight, it's the chronic care model. We have a very integrated delivery system. Our patients are kept well to a large extent, and so the margin of caring for our patients is smaller. The individuals that are sick, we try and get to them quickly. The best way to keep the cost down on any individual, whether they have funds to pay or not, is to don't let them get sick. That's how our system is designed. Not every system is designed that way. And so we will continue to track and monitor. We will continue to expand into areas where we can diversify our payer mix, i.e. bringing on more insured patients. What happens is the formula goes this way. If you expand your volume of patients, the likelihood that the volume that expands is going to be indigent is not very likely. If you expand, the likelihood is going to be that the growth will occur with those who can't afford to pay, especially if your care is good. So that's why, to Bruce's point, we have excellent care. We provide excellent care to everyone, and it's second to none. So the patient that comes in that has no insurance is going to get the same care as the one who does, and that's excellent. So that's the model. It was by design to keep our costs down and to keep our popularity as far as caring for individuals and our patient feedback high. If that answers your question. It's all into the model, built into the model. Now, to the other point of charity and other hospitals taking charity. Other hospitals do take charity patients. They take them through their emergency department because there's a federal law called EMTALA that states that if an individual shows up in a hospital emergency room, regardless of whether they can afford to pay or not, they're required by law to treat them. So patients show up in these hospitals throughout the city at large rates, in large numbers, and they are required to care for them. Now, they're not required to follow up with any care, but they are required to stabilize them based on whatever the emergency is. So what you have to think about is if the city ever decided to remove general, then all of those patients that are showing up across the city that are indigent patients in those emergency rooms will also be the burden of the city to pay because they'll ask for that if there's no Nashville General Hospital. Right now with Nashville General, the city has made the commitment and it doesn't have to really go beyond that commitment with exposure or risk.
Okay, just really quickly on the pamphlet, the annual report that was handed out on accomplishments, just looking at bullet 5 that says opened an outpatient pharmacy and secured $340 billion approval to assist people in getting lower cost prescriptions. That should just be 340B. It is a national program. We did not get $340 billion. I apologize for that. Thank you for bringing that to our attention. Okay. Are there plans for relocation or renovation of the hospital?
Okay, it's the second time this question has been asked. Today, actually, we had a town hall meeting at the hospital. The answer to the question is we're in a leased space at this time, and it is one that eventually in the next few years will come to an end on the lease. And so it's incumbent upon us to make sure that we do our due diligence and looking at reasonable alternatives as to whether or not it would be more prudent to renovate the leased space so that we continue where we are, because capital plans have to be upgraded over a period of time. We've been there a number of years. There have not been any major upgrades. So there will need to be a major upgrade if we stay any time beyond the lease that we currently have. So our due diligence is for us to provide to the city information that they can make decisions, informed decisions regarding alternative A or alternative B. Do you build new or do you renovate where you are? It's an economic question, and it's one that the city will have to, at some point, address as its place of caring for the indigent population and those others that we care for. So when that time comes, we will have to make a decision, and we should make sure that all of that information is on the table. That's what we're doing right now, is making sure that we are collecting good, solid information.
That was all the comment cards we had over here. If there's any others in the room, please raise your hand. Okay. Well, I'm going to turn this back over to Dr. Webb to close us out. Next slide.
Could we just give Dr. Webb a big hand?
Thank you. It's been a great 5 years. I've certainly felt blessed and honored to serve in this role as Chief Executive Officer of Nashville General Hospital. We've made a good bit of progress, and I hope you are equally as proud of what you have seen over the last 5 years. I want to express appreciation to our physicians for coming out tonight and sharing this with us. You guys, thank you for all that you do. It's an impressive group of individuals. To our good friend and host here, Bishop Maynard, thank you so much for having us back once again. And to your lovely wife, Dr. Mary T. Maynard, here, who is always supportive of us as well. Thank you for being here. All of our ministers, our city leaders, and the employees that came out, and others that support Nashville General Hospital. Thank you, and I look forward to another 5 years, quite frankly. Thank you to this executive team and all of that knowledge that you shared tonight. And I said earlier, it is one thing to be underserved and uninsured, but you should not be uninformed. And hopefully some of this information that's been shared tonight will put you in a better position so that you can also go forward and share it with others about the health care that's available at Nashville General Hospital. And we will continue to do that for as long as we're given that opportunity and that privilege. Thank you all for coming out. Have a great evening.